So as part of your assessment, it's really important to assess the subtalar joint. What you're looking for is you're looking for the range of movement going through the subtalar joint, and you're also looking if there's any crepitus or pain as you're moving through the subtalar joint. The more rigid a subtalar joint, you have to be aware of coming into issues with tolerance with your orthotic prescription. So this is a really good test to see how much correction you can do within your orthotic. So when assessing the subtalar joint, first we will assess the quality of movement. So we'll just invert and evert while holding the calcan on either side. And then to assess the amount of movement, I'll put my thumb under the 4th and 5th metatarsal heads, and I will put my thumb on the medial head of the talus and my index finger on the lateral head of the talus, and I want 2 inversion to 1 eversion. I'll just look